happy to have you here and welcome to today's webinar, Reopening Full Laboratory Operations. I have with me here Tom Horvath and Jonah Lee. We're going to be talking about the ways that they are anticipating preparing their universities for getting personnel back on site and working en masse. It's an interesting time because right around this time last year on May 21st, 2020, we were having our webinar Ramp Up and Reopening and talking about checklists and getting people back on site for that first time. So it's funny to think about how far we've come in a year, from just barely how do we figure out how to get anyone on site to how do we figure out how to get everyone back. So really excited to explore things and have these conversations today. And a big thank you to both of you for joining us. So if you wouldn't mind just giving me a quick introduction, Tom, if you want to go first, tell us a little bit about yourself and your background.
Yeah, thanks for setting this up, Matt, and welcome to everyone who's out there. I don't see you, but I can feel you here, right? So we're all in this battle together these days. Tom Horvath, I'm the Associate Dean in the College of Science at Cal State Monterey Bay. So we're a relatively small 4-year with a little bit of a master's program institution. So not heavy focus on research, but we definitely have an active research group here, and part of the conversation today will be talking, how we kept them active and how are we going to keep them active in the research labs as we move forward. Prior to here, I was at an R1 type institution in Germany. I was essentially an associate dean in the Faculty of Natural and Environmental Sciences at the University of Koblenz-Landau in Landau, Germany, and did my professoring years as a freshwater ecologist, limnologist at SUNY Oneonta. So I saw that there was someone else from New York out there. So peeps, all my peeps in New York, I feel you here as well.
And Jonah, would you like to go next?
Sure. Well, I think I would have to, right? I'm the only one left. So hi, good afternoon, everyone, or good morning, depending on where you are in part of the country. My name is Jonah Lee. I'm an Associate Director of Strategic Planning around the Animal Care and Use Office at the University of Michigan Office of Research in Ann Arbor. My background is a little bit different. I'm biomedical research trained. I have a PhD in bioenergetics. My research is based around molecular integrative physiology and stem cell biology and orthopedic surgery. I took an administrative role in research administration probably about 4 years ago-ish or so, and then currently in the Office of Research here at Michigan.
Great. And myself, my name is Matt Siegel. I work here at BioRAFT. We're a laboratory safety software company. And before I joined, I did research. I was a scientist doing molecular biology, stem cell biology, rare blood disease, translational research at Boston Children's Hospital. And now I help put together content for the company, host these webinars, and bring people together to hopefully get us a little closer to best practices during this really exhausting and trying times of this global pandemic we're a part of. So before we get started, this is going to be, I think, a great conversation with a lot of ideas and questions that come up. So Zoom has a fantastic feature called the Q&A tab. So if you go down to your Zoom webinar control panel and click on that Q&A button, it looks like 2 speech bubbles with a Q&A underneath it. You'll pop out a different tab where you can ask questions. And that's a great spot to put the questions you like our panelists to answer. It'll be easier for everybody to keep track of those things. You can thumbs up the questions you're most interested in, so we know how to prioritize the things to answer in the Q&A portion later in the webinar. And also you're able to respond to each other's questions. So we love this. It means that we're not just bottlenecking all of the sources of information. There's a lot of back and forth. If you have an answer, if you have a clarifying question, if there's anything you'd like to add, it's a great chance to have some crosstalk and really network with all the people here. I mean, we have a huge wealth of information across all of our attendees, and it's always nice to see the side conversations that come up during this. So would definitely recommend popping questions in throughout the webinar as they come up, not just waiting till the end, because you can have those conversations going as we're talking. So we asked our panelists to provide us with a few slides to tell us about their plans for how they're planning to reopen. Rather than having our normal sort of one prompt request here, we wanted to get a little bit more in depth so we could transmit a little more information. So Jonah, would you mind going first and just telling us a little bit about your plan and walking us through the information that you have here?
Yeah, sure. So kind of in the interest of time, and I think a lot of individuals will kind of move a little bit forward and kind of ask some questions around their unique situation, which I think is great. But I think part of it is some commonality between both large and small research institutions. I will also say too, I would be remiss. Again, my name is Jonah Lee. I'm the Associate Director for Animal Care and Use Office of Research at the University of Michigan. And our research enterprise really does span quite a bit of both human and animal work. But under the auspices of the Office of Research, we've really been trying to coordinate a united front across our research enterprise, both in terms of ramp down, ramp up, re-engagement, reorganization, and we're all using all sorts of similar types of words. So obviously from a terminology standpoint, we're speaking of the similar language in that way. So don't get thrown off if there's something specific that comes out of that. I will also say too that I have no disclosures or COI issues, so that's on the record. And then anything that I say is kind of my own opinion based off of the University of Michigan, not anything official coming from our direct office, so to speak. Next slide, Matt. So just to give us some context, I think a lot of us have some common characteristics across how we're doing things, and more often than not, again, with the consideration of diversity and different levels and intensities and bandwidth of operations. More often than not, we're talking about gradual and/or phase return to work. So lots of different considerations, both from an on-site versus remote versus hybrid mechanisms in order to kind of get back onto campus, so to speak. I also recognize quite a bit and need to kind of express that return to work is a needs assessment, right? And in many ways, and a lot of our colleagues here, we're really talking about not just research accomplishments or responsibilities, but also things like safety, compliance, and ethical components for us as well. So with all of these considerations, again, these are unifying terms for us, or unifying standards for us, and something that I think we can all kind of relate to in that way. One of the things that kind of came out of this as we were kind of organizing some of these thoughts moving forward was, special considerations, not just around restrictions, requirements, must-haves, but also where we are able to be flexible, interpret, and assume. One of the interesting things around Michigan, particularly the state of Michigan, is we have government orders, we've got governor orders, we've got state workplace restrictions. We obviously have our state OSHA, or my OSHA in our case. We all really have to pay attention to our health and safety guidelines, not again just from state and federal guidelines, but also county, localized Department of Health and Human Services, occupational health and administration, of course. And then some really interesting things that kind of throw a wrench in the whole mix around some unique circumstances with COVID research, patient data, ethics, integrity, also field work. We're lucky enough to be in a place where there is a lot of field work in the Midwest and Michigan, the state of Michigan, as I'm sure that there are across the different academic institutions that you represent. Again, just to kind of create the foundation here to kind of spark further conversation in the future. For us, we really focused on communication. Our research enterprise is pretty vast and has a lot of very unique perspectives, but importantly, we're all still part of the research group. And we want to make sure that that's not only clear and concise, but also providing guidance, particularly in a time where things tend to move every day, right? So new orders come up. The governor just announced a brand new plan yet again. It's June 1st in the context of politics and academia is eons away, and then also coming tomorrow. So I think that that's a huge portion of what we need to pay attention to. So communication and engagement was a priority for us in our mission statement, coming back to campus and really prioritizing how do we get through what we can get through safely, ethically, and importantly, still to kind of meet the mission of our research goals to begin with. So with that, we've implemented kind of a lot of communication infrastructure, strategic planning, communication planning, that really spans the gamut. Everything from emails, newsletters, town halls, which are open to both the public and to our own employees. Again, differing town halls depending on where you are, again, depending on the department, or if you're part of medical school or you're not, part of the engineering campus or you're not. And oftentimes, again, these get replicated in a specific way on a localized level. One of the things, again, that you're trying to not so much control the communication, but to maintain consistency, we've made all of these resources not only available, but then also providing FAQs, guidelines, policies, procedures that are consistent so that people do not get conflicting information coming from multiple aspects. Again, we really try to hit quite a bit of our endeavor because we are researchers, or we are helping the research enterprise, but we're still people as well. So lots of considerations around communication, engagement, and really, again, education. So helping everybody not only do their personal needs assessment, but then also where that goes in the context of their department, school, college, and university as a whole. As such, we've actually we've implemented quite a few resources, efforts, and initiatives around assessment, doing everything from customer surveys to constituent surveys to student surveys, really paying attention to the kind of existing infrastructure we had and how to pivot those. So a great example of that is quality assurance programming. How are we able to keep in touch, keep people engaged, and making sure that the qualities of our mission and values are really being upheld. That also being said, the mental health and work-life balance hold a whole new avenue for everybody, I think, particularly this past year. So again, providing those kinds of resources and providing consistent messaging has ultimately been our focus. So with that, some takeaway messaging or some takeaway guidelines, resources, like I said, FAQs, everything from seminars, webinars to distance learning, strategies that we've borrowed from our curricular groups is really where we start and end with communication. I think that was my spiel.
Fantastic. Yeah, and we'll be able to get back to this slide as well. So as we're chatting more going forward, feel free to just ask me to kind of come back to this one and we can revisit it as well. And I'm definitely curious to explore later on in the webinar, if there's time and the interest is there, more on that topic of mental health. I think that what I've uncovered in my own conversations with people is that may be that pivotal consideration that might not be getting the kind of attention that is proportional to the need present. So I'm excited to explore that a little bit more in the future. And moving on, Tom, let's get your slide up here and get your thoughts and background.
Yeah, thanks, Matt, and thanks, Jonah. That's I can say that being in a university, you're not in a vacuum, right? So you're beholden to all those local and state regulations that you have to deal with. So I'm pretty happy to be in a large system, right? So the Cal State system is quite large, and when we shut down completely. All of the Cal States shut down completely, and there wasn't any clear light at the end of the tunnel of where are we going to be in 3 weeks, 6 weeks, 6 months, etc. And being part of a large system, we can rely on all of the science teams getting together and starting to discuss what issues are we facing on our one of our 23 campuses in the CSU system. So I feel very fortunate that those conversations were ongoing, even though we weren't getting any real great guidance from higher up. Within that conversation, we started looking for good examples of how other people were doing, right? We never reinvent wheels. And we looked at the University of California system, which has a more research focus than the Cal States do. And we tried to put together something that would work for all of us. So having this phased approach seemed to work well. And we, as science deans, created something. I think we passed it up to the chancellor's office and basically received back what we sent up. So this is a collective effort that I'm presenting here. And what we ultimately landed on was this phased approach of, right now, when we first started, we were in phase 1. Pretty much everything is closed down. We went into this emergency pause situation, and then the chancellor's office basically left it up to the campuses to try to deal with their own unique situations. So the county health departments were basically telling us what we could and couldn't do, how many people we could have back on campus, how many people we could have in a particular space, and then we had to deal with that. Right. So if we look through the example on the slide here, the phase 1, 2, 3, 4, 5, those are the external conditions. We're basically just reacting to the external situation around us. The reaction or the action to that was we could operate our research labs at some sort of percentage of normal effort. And what we also weren't getting clear guidance from was what does 35% normal effort mean for research at a small regional campus, right? So what does 50% mean? What does 75% mean? So if you go to the next slide, man, I threw two of us, threw two slides together. What we decided to do in the College of Science was, get our researchers back into the lab as safely as possible. And so we created what we call our return to research process, or asked faculty PIs to put together a very short and simple plan for how they could get their researchers, their teams back into the labs safely. We didn't want this to be in a vacuum in and of itself. So the College of Science, we decided that we needed input from risk management, and we are very lucky to be on a small enough campus where we have a great open relationship with working with risk management and risk management folks. We brought in sponsored programs because we decided early on that it was really our obligation to meet those deliverables from those external funding agencies. So sponsored programs also had a voice in this committee. And then obviously facilities, right, who were in control of the buildings and the labs, and making sure that we had cleaning crews that were coming in and disinfecting areas and responding to any sort of needs that we might have had. So again, small campus, we're really, really fortunate to have the ability to work with these people and these different organizations on campus in a very close and very cooperative way. And it turned out really great, I think. I mean, for the past year, we've been able to get the researchers back into their labs. We've been able to think about where we can open up more and more. So right now we're under the 6-foot social distancing, which is dictating how many researchers we can have in a lab. But at one point in January, California had experienced the second wave, and we had to contract a little bit more. And so again, we worked with risk management and facilities, said, okay, maybe only one person in a lab is going to be appropriate. How do we do that safely? And working with the PIs, working with the facilities folks, working with risk management folks, we were able to come up with plans that were flexible enough to meet those needs of the researchers. Where we are now, where we're moving forward, is we're going to continue to look at how to safely manage those research spaces. We will probably abandon the research plan as a formal process, but keep in place some of the processes that we learned helped us maintain safe work in the labs. So the social distancing is still a requirement of us, so we're still maintaining that. We're still maintaining mask wearing in the building. So if you're walking through the halls, you're going to pass someone that's going to be wearing a mask. And so far, we've had absolutely no resistance to that, no hesitancy in maintaining those PPEs, which maybe it's useful to be in a science department where we are kind of used to dealing with high-risk situations and wearing the appropriate gear to deal with that. And we're still moving forward with this idea that the labs are going to be high-touch areas, and not that surfaces are the main carrier of the virus, but we also want to maintain that the commonly used areas, the commonly touched spaces are being cleaned on a regular basis. And we think with that, we are going to be able to keep the research open and just continue to ramp up the number of people that we're allowing into labs as we move forward.
Well, I'm excited to hear a little bit more about your perspectives and experiences here as we dive into our prepared questions here. So a question I'd like to pose to both of you, and Jonah, if you want to take this one first, that would be great, is what old or safety or operations challenges do you feel like you have a new perspective on now that we've sort of come through COVID and are looking at reopening?
Yeah, I think part of what we, I guess I wouldn't say old, but kind of established processes were really around the comms. So really a huge portion of our communications was something that we had. It was really, how do we flex or pivot our communication or existing infrastructures and really apply them to messaging that we knew people needed to understand. A huge aspect of that too was all of the exceptions, right? We are all special snowflakes just like everybody else. So everybody feels like they needed to kind of have their 2 cents on what we had. So we wanted to make sure we created a platform for people to have that discussion. Again, there was a lot of confusion in our state, right? There was a lot of things moving around that were conflicting, or the messaging wasn't really consistent or very clear. So for us, it was really kind of reevaluating our whole way of communicating. And so we decided to do that in the research enterprise by really providing the kind of go-to website resources around FAQs, guidelines, a lot of our common questions, but then having the administrative resources and effort behind them so that people can actually ask those questions and facilitate them in an efficient manner. Right. One of the worst things you can have is putting out a blanket statement and then just not having the bandwidth to field what the questions that come out of that. I will also say too that, given the diversity of what we are able to accomplish at Michigan is you really start to get into these exceptions where you're like, or not exceptions, but these considerations around, wait, does that actually make sense for us? So we actually created several different community groups that involved everywhere from environmental health and safety to public safety to, facilities and management, all the way up to IT to really help us kind of engage and evaluate where are some of these things going. So a great example of that would be, well, one of the things that did not ramp down for us during the ramp down was people who wanted to do COVID-related research. We really needed to get a handle on, hey, we can be on the forefront of coming up with some innovative and really interesting things that are COVID specific. So everything from, how we interact with clinical patients, how we interact with human research and animal work as well, around kind of how do we actually ramp up this aspect that, may or may not be under the spirit or auspices of ramping down research as opposed to ramping up. And then again, as Tom had mentioned, how do we do that safely and making sure that there's an equitable opportunity there for a lot of people. So.
Yeah, communication is just such a difficult thing. I mean, it's all compressing all of this information and updates and making sure it's standardized down into this one place where somebody just says, I want to know where I need to go to find answers to all these different questions, and then making sure you know what the questions they need to have be answered are. It's deceptively difficult.
I will add another quick tidbit on that is one of the positives that came out of this, particularly when we were moving from remote work and pushing into hybridized work, some things you just cannot do without being on campus. But there's a lot that we've been able to do from an efficiency planning and strategic aspect where we can go, well, why were we doing that in person, right? Was there an ability to flex and really learn lessons around the forced pandemic restrictions and utilizing kind of old mechanisms or meetings or processes that really had us reevaluate, oh, wow, we can do this much more efficiently independent of the pandemic regulations. So I'll give you a great example of that. Our IACUC, our animal care oversight compliance groups, we would meet every month and try to jam 50 people into one room with a ton of bagels and coffee. And I will tell you that since we've gone on Zoom, our attendance has been nearly perfect every single time, which has never happened. So again, these considerations of opportunities, positive opportunities that really allowed us to kind of reset and do another needs assessment on what are the goals of what we're trying to get accomplished here. So, Tom?
Yeah. Same question. Yeah. Are there any old safety challenges or operational challenges that you feel like you have a new perspective on?
Yeah, I think what we had to do to maintain some order in terms of limiting the number of people in labs was to create a shared calendar type system so that other researchers who are sharing lab spaces, who might have multiple PIs in a small lab space, that communication is now being very efficiently done, as Jonah mentioned, through the shared calendar system. We don't think that that's going to go away because obviously we can't really jam many more than what is currently being restricted in those labs at the same time. So that also gives us an idea for how our spaces are being used and for how long our spaces are being used. And that sort of information is helpful when we start thinking about planning for the future. How many more research spaces will may we need in the future? We'll now actually have some hard data to use for that. The other side of it, I think, is also in that communication that Jonah mentioned. I think we're much better poised now to have conversations with risk management, with sponsored programs, with facilities than we were in the past. Not that those were ever strained, but this has really forced us to have those conversations and to have those dialogues with these other campus groups. And I hope that those don't go away as well.
Yeah, it's hard to get together that really concrete, confident data about just your spaces, the people you have, the hazards that are present. Those things shift all the time without your knowledge, but so many things are based on that. And I'm sure that I guess I'd imagine rather that information helped to inform your conversations with risk management, emergency management facilities, and probably made that maybe a little bit easier.
Yeah, definitely. So, I mean, even moving forward, we're still going to have issues in the lab. Hood's going to go down at some point in time, and having the ability to just reach out and have that one-on-one with, the head of risk management or environmental health and safety, that's going to be invaluable.
Would you say that now you sort of have a higher standing, just sort of being more involved with the safety process in these other people's minds, and that these sort of relationships are just generally stronger in places where they weren't present before?
Definitely. And there's a new respect for each other, what we're doing, what we can bring to the table.
Yeah, we've definitely seen a lot more of safety being seen as a collaborative kind of centerpiece to the whole laboratory and research enterprise. I think when before it was, again, more seen as that compliance checkbox and policing role. So, Jonah, I was wondering if you could talk a little bit about the communication challenges that are coming up. I know you'd mentioned that was a real push for the University of Michigan, and whether there was anything else there that you've identified and thought about as just an upcoming difficulty that might be able to help our audience out with. And apologies for my background here. I'm not sure what's going on. Maybe it's the humidity or Zoom having difficulties, but getting some green screen flashes here.
Yeah, I think it's the pandemic is a nice way to compartmentalize kind of continued needs assessment, which I know all of our institutions do in general, and part of where a large proportion of the challenges have really become is just making sure the consistency is there, right? We want to make sure that our AVPs and our deans and our chairs and our students are all like very aware of kind of what the expectations are. And I think part of that too goes back, and kudos to our teams here at Michigan of really providing opportunities, right? So like I said, our president has weekly COVID briefings. Our medical school deans have weekly medical briefings around topics that are not just rotating, but then also as information comes up and out, again, particularly from, so let's say the CDC or the state, we are reinforcing what we are expecting from individuals. So a great example of that would be our mask requirement in the state of Michigan versus our contact tracing guidelines versus our mechanisms around social density. It's, what is actually 6 foot distancing when you've got a room of 144 square feet or, let's say 2,000 square feet, does a bay in a particular laboratory, is that a good enough barrier? What if I put up a barrier, right? And, particularly when you think about it, here's a great example that I always used to use, which is if you're in the operating room, if you're in the OR, you are sterile in theory, right? Hopefully. Do you need to be 6 feet away from the person who's helping you with the surgery? You are probably the cleanest you will ever be. So what are we actually talking about there? So there's a practicality there that really, again, we really try to emphasize not just communication, but then realistic and true evaluation of what is safe versus what are we actually doing in terms of following guidelines to making sure that people are not just comfortable, but also knowledgeable, right? So again, one of the biggest things you can do around research to hinder research is to provide inconsistency or an inability to kind of feel comfortable about what you're trying to get accomplished there. So
we've seen that come up on a few other places as well, that hyper focus on COVID risk to the disregard for other risks present that might be, much greater concern to health and safety. And look, Tom, looked like you had something to add there.
Yeah, no, I was going to say, and there's this coming together of different risks and how to deal with them. So I'm wearing a mask, but I need goggles, and are my goggles fogging up to the point that I am going to make mistakes in the lab? Am I standing next to a hood? Am I not standing next to a hood? Should I have a mask on? Should I not have a mask on? I mean, ultimately, we're going to be held to the Cal OSHA, some of the other external regulatory bodies recommendations, and we'll do our best to follow those. But I think Jonah's right. At some point, I mean, generally we're all in the science field. You want to be able to act on the information, the valuable information that we have, and do it in a way that works for people, not only their physicalness but also their mental health, as you wanted to bring up at some point, Matt.
Yeah, absolutely. And I was thinking as you were speaking about that, this thing that I've seen a lot in my life, which is this disparity, even in people who have science backgrounds, in the data about vaccination and safety versus what has just been drilled into our like deep psyches about being around other people, being unmasked, safety, and all those things. And I think that there's going to be a lot of instances where we are butting up with facts and new information against this kind of classic human, less rational response. You know, now we're being asked to say, hey, all of these unusual safety measures that you just shoved into your life and really like wrote into your mind, now you have to disregard those. They're fine, they're gone now. And there's going to be, I think, a lot of difficulties in how people are speaking with one another and communicating. I know Jonathan's probably on mute there thinking a lot about stories and how we communicate risk, and I'm sure that'll be a great topic for the future, but I'm sure that'll be something I'm hearing a little bit from both of you. So Tom, I had another question for you here, and sorry, I'm going to mute myself in a second if these sirens don't get better. But when it comes to fully repopulating scientific spaces, what's one challenge that you feel like you still don't have a great answer to?
Yeah, I think it is going to be that idea of how, even with a set density that you can have in a room, knowing that people are going to be moving close to each other at various points in time, does it make sense to have a set density in a room that you know that people are going to be using shared equipment in a close space? What makes sense, and how is that workable for the student researchers? I mean, we have a focus on getting undergraduates into the labs for research experience. How do you train someone without being in close contact with them? That's going to be a challenge for us, I think, moving forward. Muted,
Matt, I think you're muted.
Yeah, sure I am. I was wondering, Jonah, if you could tell us about a scenario that you were surprised to realize existed, sort of an unknown that you might have uncovered.
Yeah, I think, and that kind of maybe leads into the segue that you wanted to talk about here a little bit is, you know, it's so interesting that how many meetings we all have to go to, both pre-COVID and during COVID. You know, I think if you're anything like me, you've had a lot more meetings that you anticipated. But one of the things that came out of that really had to do with, you know, how much, how a good and efficient meeting gets run nowadays, right? So part of it is, yeah, I used to go to these meetings sometimes where it was like, thanks, that could have been an email, right? Just like everybody else. But the value of going there and having the face-to-face interaction, the value of having that kind of connection point, the value of pulling somebody aside 5 minutes before the meeting and 5 minutes after the meeting where you can actually, you know, hash things out, you know, go jump into an office or a conference room. That has significantly impacted not just, you know, a mental state, but I think also productivity. So, you know, for us, we're really discovering on the mental health side, the, you know, intellectual equity side, you know, diversity, equity, and inclusion, you know, HR processes and resources that would help facilitate those things, you know, everything from mental health webinars to, you know, true exercises around, hey, have a meeting where you're just talking about social stuff. I think that that's proven to be pretty valuable, if not something we can't easily measure from a data-driven results section, but we do know that those anecdotally have appreciated those kinds of extra efforts around that. You know, yes, it might be another Zoom call, but also if you're just kind of, you know, rehashing the water cooler or talking in the hallway and finding some other platform for that, that can go a long way on morale.
Yeah, so I'm definitely curious to hear whether either of you are anticipating having people who are really resistant to coming back. maybe they've, again, had a worse experience with COVID, either from an experiential point or just more from just a psychological, it affected them more. These people who, again, have gone into more of that, irrational place where it's harder to communicate with them, whether there are any plans to accommodate those folks or just sort of generally speaking to accommodations for people who might be less willing to or excited to come back.
Yeah, so again, we're very much a student-centered institution in terms of the research. So if students feel comfortable being back in research labs, it's not a requirement of their degree to do that. However, we know that it is a high impact practice, right, to have undergraduates getting some research experience. So I think it's going to be a matter of them becoming comfortable and seeing their peers go through those situations. So it may not happen right away, but I think maybe by the spring semester, when we're in less of a transition area of getting people back to campus, that students will be able to have that experience again. So it may be a little bit of relying on the peer experience that gets them more comfortable being in the labs. As for the researchers, they want to be back in the lab, and I haven't at least experienced any hesitancy from that side.
Yeah, I'll add. I think this goes into, and I'll argue that it's not rationalized or irrationalized. I think it's perspective. I think part of this has a lot to do with, again, reassessing not just risk and liability and compliance and oversight, but the true, something that Jonathan Klein and I talk about a lot is, what is the culture of your research enterprise? What is the culture of your lab space? What is the culture of your PI's driven motivations and mentality? I mean, you've got a lot of opportunity there for ethical, motivations, both good and bad, right? I think that's a huge aspect around people's willingness to do their own self-assessment and risk assessment. I think you have to leave space for that. That's something that we at Michigan try to pay attention to. I think like many across the state and like many of our institutions, we are a public institution. So, we cannot require vaccinations. We cannot require or ask somebody from an HR perspective whether they are or are not vaccinated, which, sounds silly to some, and others it's like, hey, that's my individual right. So what we can do, though, and what something we're charged to do as administrative resources is, be cognizant of that and find opportunities to where that comfort level is not just educated, but then also some expectations are consistently put in place.
All right, sort of that, how can I help you help yourself get to the point where you're doing what you want to do?
I like that. Yeah.
I was speaking with, Amy Thomas, the director of health and safety over at California State University, Monterey Bay. And she brought up this great topic of psychological first aid, which I think is just fantastic. It's a training that you can do that they give to people who respond to natural disasters to help people get from that place of shock. If anybody's heard of polyvagal theory before, from that freeze response where you can't actually get up to more social, there's sort of three levels. There's freeze, there's flight or fight, or fight or flight, and then there's sort of social and welcoming. And sort of the idea being you can't jump and cross through things. And freeze is kind of that trauma, grief response of I can't move, what am I going to do? And you have to ease people out of that. So this idea of psychological first aid is sort of to help people transition through that and get them answers and get them help and triage them. That's all to say, COVID has absolutely caused a communal grief and trauma. That is just something that I think I've seen pretty well agreed upon. And knowing that and approaching it in that way might make it easier to help understand why some people might be more hesitant to return or might be more anxious or have a greater amount of fear there. So giving them space, having the resources to help them, not blaming them, and kind of helping them feel comfortable can make a huge difference in terms of how quickly they might be able to return or feel safe again.
I'll add that the terms empathy and compassion mean something very different nowadays for many of us.
Yeah, I mean, perception is real for the individual who's perceiving it.
Yeah, it certainly is. Well, it looks like we've got quite a lot of great questions here over in our Q&A, so I'm going to say, unless there's anything else that the two of you would like to just sort of bring up or mention before we move on, that we can go ahead and transition over to our Q&A portion.
Let's do it.
That's it. Yeah.
Fantastic. So right before we do that, I'm going to launch a quick poll here and do a quick pitch. So we have some upcoming webinars here. Next week, or sorry, 2 weeks, we're going to be talking about scientific H&S career growth possibilities. So this is going to be a great one, getting people from consulting, insurance, also Associate Director of Health and Safety. Hopefully I got your title right, Sarah. And it's going to be a really nice panel to talk about what you can do with a health and safety career. Then we're going to be talking about conflict resolution techniques, as we're sort of exploring here. We'll be finding ourselves in probably a lot of conflict coming forwards, and knowing how to navigate that and guide that towards resolution will be really effective and useful. And then after that, our newest webinar will be reducing hazardous waste costs, looking at waste minimization, stream consolidation, all this fun stuff and ways of reducing the overall cost of your program. And also, these are the EHS community connection webinars. So we rely really heavily on you, our health and safety community, to keep them going, from telling us about topics you're interested in so we can keep these relevant, to also finding more panelists to keep coming onto these and making them possible. A huge thank you, Tom and Jonah, for donating your time and helping to create this space. I mean, it really wouldn't be possible without you. And I'd love to be able to meet some of you, get you on here, talk to the folks in your network who could also help keep these webinars going. So I'm going to keep that up for a little bit while we move on to the live Q&A portion. So a quick reminder, if you go down to your Zoom webinar control panel, there's a button that says Q&A. If you pop that out, you'll see there's already a lot of great conversation going about different concerns about this idea of reopening and expecting what will happen. You can respond to each other's questions. You can thumbs up the questions you're most interested in, and it'll just make it a lot easier, again, for us to discuss the most relevant stuff to you. So the top question here is from Stephen. Stephen would like to know, is anyone considering asking which people are vaccinated as they return to work? So getting into that a little bit, but would you mind extrapolating on that anymore?
Jim, why don't you take that?
Was that me? Okay, yeah. I just realized I don't think the panelists can, or the attendees can say anything. But yeah, so part of it is, again, a kind of a respect factor for the perception that we were just talking about earlier. But then also part of it is just true. We can't really ask that stuff from an HR perspective on how we end up working on some of those components. I will say that there is an interesting. There's interesting data that we've been able to collect that really hasn't been that we compile on a normal regular basis and communicate what we can communicate on that stuff. But from a vaccination percentages, Southeast Michigan was hit pretty hard in the context of individuals who had COVID related incidences, but also, we were also pretty interestingly diverse, when it came to people who were vaccinated or not vaccinated. It's not really a question that we can attach restrictions to. So that may be state to state independent, that may be private to public institution components, that also may be something work or research specific related.
Yeah, and at least in the Cal State, we're about to get a memo out from the Chancellor's office about vaccination. So at the moment, what we're hearing is that students, staff, and faculty are required to be vaccinated to be on campus. And if you have an exemption, a reason to be exempt from that, the Human Resources group will deal with that. But we've been also told that those that are not vaccinated will be put into a regular testing program that has a higher number of tests, more regular testing than the general population. And without knowing who's vaccinated and unvaccinated, I'm not sure how they do that. So I'll be curious how that rolls out here. Because I think Jonah's right. We can't ask who's been vaccinated or not vaccinated.
Yeah, and definitely being aware of that risk of trying to require or solicit that information is good. Checking with your HR programs and making sure you're not maybe overstepping something or causing some liability will just be a good precaution. Next question here, similarly along vaccines, is from Veronica, asking if institutions are following the CDC guidelines for fully vaccinated people. Basically, if you're fully vaccinated, you don't have to wear a mask either indoors or outdoors now, sort of with the most recent announcements.
Yeah, I will say that that's something that we as a research enterprise communicate out quite regularly. And part of it, again, has to do with the consolidation of not just CDC guidelines, but then conflicting information with maybe state guidelines or county guidelines. That's something that our general counsel and safety groups at Michigan really do have from a consideration standpoint. I think everybody's got a different risk level, and every institution needs to kind of determine what their risk level is going to be in terms of facilitating and or making those expectations known. I will say, though, that the responsibility, in my opinion, for every institution is, regardless of what the decisions are, it's their responsibility to communicate that out in a concise and clear manner.
Yeah, we're waiting for guidelines to come down from OSHA on how we can react to vaccinated versus unvaccinated people, masking, no, not masking.
Yeah, there's also just a lot of very complicated stuff around honesty around vaccination, miscommunication around what does fully vaccinated mean. That's been a term I've seen has caused some confusion, and also difficulty for other staff. I've in our previous webinar, I want to say it was after the vaccine, looking at health and safety after the vaccine with Craig Merlick and Mary Luco. One of the topics and conversations that came up was this concern about a janitorial or custodial staff seeing people around who weren't vaccinated and wondering and having that concern about, okay, am I safe here? Am I safe going into this space? Can I do that? And what a mask communicates without the ability to have that, I'm vaccinated medal that's official and sanctioned. Being a little more cautious might not be a bad thing, especially as we make these big changes. I think COVID has taught us to, take baby steps, do small changes, and then maybe if everything's working, look at reducing mask use. But that would definitely simplify things to not have to worry about who gets to wear a mask and who doesn't in what conditions. Great. Next question here is from Cherry, asking, we moved the majority of our safety training into a virtual session with a small in-person portion for COVID, and we think we will keep this in the future. Is there anyone else who's keeping their safety training virtual where possible? So yeah, whether you're thinking about going back to in-person training, sort of excited for that opportunity, or whether the virtual training has actually been one of those unexpected boons.
Yeah, our environmental health and safety officer, Monterey, has been great at getting students and staff that need the training. But I think it's going to be a lot easier for him once everything is converted to a remote, which is what is the direction that we're moving in now. So we're hoping that in the future, at least the very basic training will be done remotely, and it's easier to track to make sure who has had training and not. But the hands-on stuff is going to happen in the labs with the investigators, the principal investigators. So we expect that to still have to happen.
Yeah, Sam, I think this goes back to the theme of what we're talking about here is understanding, appreciating, and communicating the expectations, but also evaluating on a localized level. I think there's a lot we can take advantage of with virtual training, but there's only so many ways I can read about scruffing a mouse. At some point in time, I'm going to have to learn how to do that, right? So, as you go in there in particular, which I think there was a conversation earlier about vivarium spaces. Yeah, you can't change rodent cages virtually. So yeah, our vivarium spaces were in person, and a lot of our operations did not ramp down just by need.
And if anybody's curious to learn more about this topic on training, we've had 2 webinars in the past, one on designing safety training that sticks and one on creating engaging safety training. Both of those get into this tricky topic around in-person trainings that really can't be substituted, like changing mouse cages or getting hands-on experience with a fire extinguisher. So those are some good ones to take a look at for useful advice as well. Great, looking through here. One follow-up question from Stephen, who asked a previous question about requiring or requesting vaccination information, is a follow-up about why doesn't HR allow it? Is that a local policy or a HIPAA issue as people decide to tell you? Do you know if there's a sort of explanation behind the background there, or is that something that's a little bit outside of your area of expertise?
I would default to what you just said about outside the area. My speculation is a privacy issue.
Yeah, I think HIPAA is playing a role, but again, I will stay in my lane.
No.
Great. So that seems like another great reason to go check with your own personal, HR group rather than necessarily taking that decision into your own hands and overstepping in a pretty major way potentially.
Yeah, and I think as Jonah mentioned, our legal counsel has discussed this, and the guidance that we're getting from them is that statewide, it's okay to require vaccination, but after that, I don't know.
Great. And as I'm looking through the Q&A here, if either of you two see something that you'd particularly like to answer, just let me know and we can discuss that one as well. And Veronica chimed in saying that it is a HIPAA issue, potentially.
Thanks for that clarification. Yeah, I wanted to say that, but I wasn't an expert on it. Yep. I will say too, in the context of virtual versus in-person training, this is actually something that I'm finding out a lot with our safety and regulatory compliance professionals. Virtual versus in-person inspections. I think this is actually a pretty interesting hot topic, particularly around some of the regulatory compliance and oversight administrative groups that we have. We can walk through, a lab via FaceTime, or, we can go through the documentation ahead of time. We can maximize and try to be efficient about the time we spend by exposing, person-to-person contact. But, like many of you safety professionals know, sometimes you're only going to get shown what people want to show you. And so that becomes a little bit of an interesting mix between, yes, I would love all my inspectors to be at home and safe and not exposed to people, but we still have a job to do. So that requires, a great example of this is our controlled substances quality assurance programs. They have to go in because they have to see the drugs. I mean, for as much as you can show me a picture of it, that's a DEA requirement. So that's actually one of those things where we have to bounce back and forth. It's just like, wait, what are we actually being asked to do? What is the goal to be accomplished? And how do we do this in the most safe manner while still meeting regulation?
Got a great question here from Beth asking, anyone planning to quarantine students in fall who return to campus after travel if they're not vaccinated following CDC travel guidance?
I haven't heard that mentioned at the Cal States yet. So as of June 1st, our travel ban will be lifted. So we will have to deal with that at some point in time again.
Yeah, I think, again, I'm speculating here, but I think a lot of that gets addressed, certainly not answered, with consistent testing programs. So a lot of the things that we do in terms of testing, in terms of quarantine, we have a lot of facilities and a lot of processes and programming around quarantine and kind of what ends up happening when a positive test comes about. I'm not exactly sure what Michigan does specifically when it comes to travel. So I do know a lot of academic institutions across the country have kind of manipulated spring break and kind of like where things were going so that they weren't leaving and then coming back and then leaving and then coming back throughout the semester time. But I think those are pretty nuanced to how the local institution deals with that.
And then a comment from Hans, just noting that vaccination requirement seems to be a watch and see, and that people seem to be, discussing the best way to collect information, ask for it, require it, how to potentially have a variable policy based on vaccination status, 1 shot, 2 shots, the 2 weeks afterwards, variant presence in the mix of infection. It's a whole lot to take it into account. So it does seem like the prudent thing to just say, hey, just wear a mask. Other people we're already taking a big step forward in terms of repopulating. Let's cross that bridge next time once we've already gotten our feet under us and we have again a new baseline that might cause issues and cause us to roll something back.
I mean, I personally will probably continue to wear a mask when I'm in a grocery store, for example. I like going an entire year without ever even having a common cold, so they're effective.
A question here from Delia asking, Jonah, where is Michigan at in the process of occupancy and returning to the labs?
Yeah, great question. We are at, the last meeting, from what I recall, is either approaching 90% or about to approach 90%. And we did that in a phased manner, just like everybody else did. I think we were at like 60% occupancy early on, early in the kind of winterish semester, kind of coming back forth. But, a lot of that, to be fair, was just, appreciating, and this is research occupancy. So we're talking about like the PIs and the lab groups themselves. So other operational occupancy obviously depended on where we were going. So things like veterinary or animal husbandry care, that was almost always, that never really dropped down, just because of the amount of work we actually need to get accomplished. And that's actually something that I will say, we've been planning for quite some time and done a ton of benchmarking. We're really looking at a lot of our peers in academic institutions of like size and scope. So we really there was a lot of these kind of feeling each other out and seeing what our peers were doing from a benchmarking standpoint. So, and then obviously, referencing our own state and federal guidelines.
Well, it is already 4 p.m. Eastern time. That's the end of our scheduled webinar time, but there are just a few more questions, it looks like, here that we might be able to get to. So as always, a big thank you to our panelists for joining us. If either of you need to get going, time restrictions prevent you from sticking around a little longer, we completely understand and appreciate your time and expertise. And if you're able to stay to answer 1 or 2 more questions, you are certainly free to.
I can stay for a few minutes. Thank you to BioRAFT and Matt. Also, just as a mention to everybody else, I gave Matt my email, so feel free to email if you want to engage in more future conversation as well.
Yeah, and I believe that is posted on the webpage. So if you visit our registration page on the BioRAFT site, I'll go ahead and, I guess I can't pop that into chat too easily here from my other computer, but somebody can grab that for me, hopefully. The Reopening Full Scientific Operations webinar page, Jonah's email is there, and that could be used to contact him.
Yeah, I'm not sure I gave my contact information, but Google finds everyone. I'm certainly happy to answer. And thanks, Matt, for setting this up. And thanks to everyone that's out there. The conversation that I'm seeing in the chat and the question and answer, these are concerns that we're all having. So it's great to see that we're all one giant community out there.
Yeah, and it is really nice. And I wanted to appreciate all of you, our attendees, for joining in and chiming in on our chat. I mean, this is definitely unusual for a webinar to have this much engagement and conversation going back and forth. And it's just great to see that communal helping happening. And this not just be, again, about putting 2 people on a podium to preach at you, but really a chance to share all of the information that we all have about our experiences. So it looks like the last question here that I'm seeing from Andrea, I'm going to compress this one a little bit, but basically that PIs tend to be very vocal about dropping masks and distancing for employees. So how do you navigate that particular issue where you have, these folks who are just really insistent, hard-headed, maybe very tunnel visioned, saying, no, the CDC says this, we don't need to do this, versus what you're trying to enforce from a safety policy. Have either of you encountered that challenge before in this, context?
I'm not encountering it, but my response to something like that would be that we have to follow guidelines that are coming from state organizations. We can't smoke in the lab either. So.
Yeah, I think, the intensity of maybe where that question was lying, I have not experienced. I will say too, that one of the interesting things that, and it goes back to, a mentality or a morale. And again, this is a credit to our mission and moving forward with the approach that we have with communication. A lot of our research enterprise and community is just very like understanding. It's just like, yep, I get it. We got to do that. Cool. Here's some extra steps. It's going to take me a little longer. I mean, there's a lot of, again, empathy and compassion really goes back down to it. I mean, we're all content experts in our own ways. We're all collaborators in our own ways, but we're all first and foremost people who are just trying to help each other. And so I think that's a big aspect of acceptance and compassion for each other. So there's not a whole lot of, dissension in the crowd, I guess I should say. So hopefully we want to keep it that way.
Yeah, Matt, there's a great question from Vance in the Q&A about exposure control in unique spaces like walk-in coolers. I don't have an answer to that. Maybe Jonah.
I was going to get to that in one sec. I had a quick response to Andre as well, which is just that's a classic thing, right? You have these PIs who are saying, this is what I think we should be doing for mask policies. And then that turns it into this classic adversarial conflict, which doesn't really have any winners. You can't win an argument. This is what we're going to get into somewhat in our conflict resolution techniques. That's a spot where if you can, go to your upper management and say, hey, we are trying to get these people back online safely. And then you can go to these PIs and say, reframe it as saying, I'm trying to help you get your research back because you need to meet these requirements. And then it's you helping them to get their research going again, rather than having it sort of you be the bad guy with the stick saying like, put your mask on. If anything you can do to reposition that and help them kind of see how, regardless of their own opinions, these are policies that are intended to help them come back, might be able to help that out. Great. And then, yeah, Tom, you saw this question from Vance about cold rooms and the exposure control there. So any comments around managing safety in that space?
I personally think that that's a great question because it's a very unique case study example of our whole operation, right? Which is don't do things by yourself, get a good risk assessment, needs assessment, and go talk to the people you need to talk to. Our EHS is great about providing the content expertise, evaluating the needs, doing the risk assessment with the researchers, but that only happens with the culture to which you provide that says, hey, I need to go talk to somebody about this, as opposed to just like, probably safe, I should just do it, right? And so again, this goes back to really one of the interesting things that COVID has done for us is really, hey, let's take a step back and learn what COVID has really spotlighted for us just on operations alone, not just pandemic specific operations. So without answering that question by answering it, I would say using those as lessons learned and really, it really gets you to appreciate how much we are a community and not just a bunch of island nation labs.
Yeah, and for us, those would be what we would consider shared spaces. So that having that communication amongst the different lab units that are using that space would have to occur, and hopefully we're better at that now than we were before.
All right, well, that looks like everything to me. So big thank you again to our panelists for joining us, sharing all of their information, expertise. You can take one quick look here before we move on just to our prompt and kind of see some of the advice that we might give to our past selves. I think that, again, looking back a year, Tom, I think on your slides, the date on there was, yeah, literally just a year ago. It was in late May of 2020. So we've just come such a far away from how do we get anybody back on site to how do we get everybody back. And it's nice to have those benchmarks to really feel like, regardless of how terrible this past year has been, we've made progress and we will keep making progress. So stay strong out there, everybody. Hope you have a great rest of your week again, and I will talk with you all in a few weeks.